Idiopathic pulmonary arterial hypertension patients should receive first test. What will you do in idiopathic pulmonary arterial hypertension? And the answer is we will do a vasoreactivity test. If the response is favorable, then you can give calcium channel blockers. If it's without the favorable response, then you can give bosentan, which is endothelin antagonist, or sildenafil, which is phosphodiesterase inhibitor. Next, what is the treatment for osteonecrosis? That is avascular osteonecrosis. The goal of the treatment is to preserve native joint, and then that's why you do a conservative therapy. If the conservative therapy does not work, then core decompression should be done for stage 1 or stage 2 of osteonecrosis. If core decompression is not working, or it's stage 3 or more than stage 2, you can give osteotomy. You can do osteotomy. But for stage 4, for osteonecrosis, total joint replacement should be done. Stage 4, basically, if it is for hip, stage 4 means a flat femoral head and narrow space. What is the most sensitive imaging for diagnosing osteonecrosis of femoral head? And the answer is MRI of the hip is the most sensitive test for osteonecrosis. Next, what are the causes of osteonecrosis or avascular necrosis, or which is also called as osteochondritis dissecans? What are the causes? And the causes are steroids, alcohol use, SLE, sickle cell disease, antiphospholipid antibody syndrome, chronic renal insufficiency plus hemodialysis. So, in a patient who has chronic renal insufficiency and also receiving hemodialysis can have a vascular necrosis. Trauma can cause it. Gaucher's disease can cause a vascular necrosis. HIV, renal transplant, and Casson's disease. Casson's disease is decompression syndrome. Um, all these can cause a vascular necrosis. Next, what is the greatest risk for avascular necrosis? The greatest risk for avascular necrosis of all is SLE patients who are on chronic high-dose corticosteroids therapy. High-dose corticosteroid therapy means more than 15 to 20 milligram per day. If the patient has loud S2, chest X-ray has enlarged pulmonary arteries, and EKG shows right axis deviation. That suggests pulmonary hypertension, and that should be confirmed by echocardiography. So again, if the patient has loud S2, enlarged pulmonary arteries, and right on X-ray and EKG right axis deviation, this suggests pulmonary hypertension, and you should do an echo to confirm pulmonary hypertension. Next. So for the patient, for the transmission for HIV, standard precautions do not apply to occupational transmission of HIV. The question is, Transmission of HIV, standard precaution do not apply to what, or occupational transmission of HIV has never been documented with what things. The answer is it has never been documented with or the transmission has not been documented with urine, tears, sweat, sputum, nasal secretions, feces, as long as there is no visible blood in these. Next, if the patient happened to use if there is an accidental usage of OCPs during pregnancy, what will happen? The accidental usage of OCP during pregnancy is not associated with increased risk of fetal malformation or teratogenicity. Thank you.